Hello, my name is Christian Brayboy. I'm a Robertson County Mass employee. I'm also an FTO for the county. Today we'll be going over how to use a LifePak monitor. Now each facility and each company use their own monitor, so I'd recommend learn which one you have, but today we'll be learning this. Today we'll be trying to teach you how to use just the basic functions such as using the 4-lead to check for heart rate, using blood pressure, cuff, using the SpO2 monitor, and learning how to actually use some of the different buttons and functions on here. So, as we're going over equipment, you have your blood pressure cuff up here. The SpO2 sometimes is here in the back, depending on who you work with. Sometimes it's here in the side. And you notice your 4-lead cables are also right up here and tight. We recommend that you keep your cables tucked neatly and wrapped up properly, because if not, they can cause damage, they can cause wears, and you might get either misreading or some of the cables might not function. That's also included for the SpO2 monitor as well, because if this isn't stored properly, it also might not read because it will pull up the heart rate and SpO2 on the monitor. Same thing with the blood pressure cuff. You might get errors saying that your blood pressure cuff is not reading properly, or you might get false readings whenever you're trying to assess your patient. Now, for operation wise, first thing you want to do before you even get on the road and start treating your patients, you need to check your batteries. Simply by cutting this on here on the on button, just smash and hold it till it cuts on. You should see some power indicators. You have at least 2 batteries, at least. This will print out, which is fine. You should see some indicators, the green bars. Now these are both full. If they were not, simply just flip your monitor down, and there's a pack back here. Lift it up, it's Velcro sealed. There's a yellow tab, pull it back. Pull it down, lift it back up, and this will show you where your batteries are. And if, just in case you want to do a quick check, smash these 2 buttons and you should see some lights light up. Simply just click and remove it and replace said battery. And start your shift. This is also a good time to check and make sure you have all your other accessory equipment besides just your regular vital signs. You should have at least a end title for nasal cannula and an end title for an intubation tube. Some people also like to store that extra cardiac monitor paper here, as well as having a razor for your hairy patients if you need to attach defibrillation pads or your electrodes. Some defibrillation pads are stored here on the side. You should at least have 1 adult and 1 pediatric. Make sure they're in date. You should see a little hourglass down here on the bottom of your packaging to let you know that it's in date and still rarely used, even up here on a pediatric. In here is a cable. This is how you connect your defibrillation pads. You should have 2 arrows. There should be arrow here on this cable, and there should be arrow on the defibrillation pad. Just line up the arrows and plug it in. So, now we're going to go over vital signs. Now, with your patient, cut your monitor on. Some people like to wait before they cut it on, get everything hooked up. But we'll go over blood pressure cuff. Now, as you can see here, you should see where it says left arm artery and right arm artery. When you place it onto a patient, make sure this lines up here correctly on the brachial artery. So you attach it here. Make sure it's faced up properly, because if you place it the wrong way, it'll inflate and pop off and you won't be able to get accurate reading. Pull up pretty here, get it really snug. This is the right arm, so we're going to follow right arm indicator here. Gonna wrap it really tight. Make sure it's really snug, not too tight. Velcro seal. Make sure this is connected, because if you try to inflate it, it's not fully connected, you'll get an error or it won't read. Next, we got the SpO2 monitor. Now, it's recommended not to use the SpO2 on the same hand, because when the blood pressure cuff starts to inflate, you might get a false reading or it might not read at all. Simply place it on one of the fingers. If you have a female patient or a male patient, fingernail polish remover is recommended because sometimes they might have their fingernails painted and you might not get an accurate reading, or it might not read it all properly. Once that's placed onto the patient, for blood pressure, simply hit NIBP and then you start taking. This is a good time to let your patient know this is going to get tight. Stay still and try not to move. Because when the monitor is trying to read, too much movement, it'll keep recycling higher and higher, and it'll continue to stay tight, and the patient might get uncomfortable. So just no more than 30 seconds to a minute at most. The blood pressure should read, should give you some type of reading sign. Now, when you place the pulse ox on, you'll have a pulse ox indicator, and you will have a heart rate. I'll demonstrate right here. And it might take 30 seconds. It'll tell you to check for a pulse. Some patients are very cold. It's recommended to warm your hands up because it might not read, or it might give you a false reading. That's something else to indicate. And if you're having issues, oh, there you go, 100%. Sometimes the heart rate will pull up, sometimes it won't. Depends on what you have hooked up. Now, I do have some demonstration equipment in the back, so that's probably why it's not pulling it up here. But if that doesn't pull up, either try unplugging it and replugging it back in, or see if you need to fix anything else. And to the 4-lead cables. Now, simply unwrap it. Make sure this is connected up here to the top. For demonstration purposes, for a mannequin, I have a different box here. But all your cables should be labeled. If you look here, say LA, RA, LL, and RL. Right leg, right arm, left arm. Simply get your electrodes. It is recommended to attach electrodes to your patient before you put them on the monitor. Before you put electrodes, before you put it on the patient, because if you try to press it on the patient before having it connected, it might not click, it might cause them pain, you might keep pushing, it might hurt them, you might. What I'm trying to do, try to make the patient somewhat comfortable as best we can. Simply attach it to their upper extremities or shoulder pad, up their shoulder. And it's recommended to place these on the lower extremities for their left leg, on the right leg, because if you place it up here on their stomach, you could get a false reading from a person who's having difficulty breathing or breathing really fast, and you might get a false reading, and you don't want that. A simple trick to remember if you do have cables and they're not labeled because they're worn out or just might be a different brand, this smoke over fire. So you have the black smoke should be above the red fire, which is your left leg, left arm. And then your grass is always green and there's clouds in the sky, so it's white. It's a good little trick just to remember if you're in a panic or you're in a rush, hopefully not, and you just don't have labels. If you have somebody new who's never done them before. So when you hook them up, you should get a heart rate on the monitor. This will help you determine if you need to do a full 12 lead, which we don't have cables for. It should be here on the side. If you want to go ahead and do a full 12 lead. And simply for a 12 lead, it's just, you should have V1 through V6. Now, simply like I said earlier, some people like to go ahead and put the cables on first and have some people have these preloaded. It's just preference. You don't have to do it, but it is a time-consuming thing, and just kind of, if you have a very critical patient, it's much faster to have these preloaded, and they will have them wrapped up in the back, but be mindful because sometimes they could slip off or it could cause issues later on. So with your 12 lead cable, you want to go V1, V2. These electrodes have a little tab here in the back, so it's easy to grab and pull off. If you're having a hard time, or if you're wearing gloves, sometimes gloves can make it difficult to grab these electrodes. V4 goes down here. You want to follow underneath the breastbone on this rib cage here. I skip V3, but that goes here between V2 and V4, right here. V5, right beside V4, and V6. Now, a lot of people fail when they try to get a 12 lead, they'll hit 12 lead and it's like, it's not pulling up. How come it's not pulling up? I don't understand. I got everything connected. Check this. Either this isn't properly secured or you didn't plug it in. Once that's plugged in, you hit 12 lead, and then you select your patient's age simply by using this dial here. Click it in, and then you select male or female. Click it in. See, it says check printer. So there's an error with the printer, right? I'm out of paper. So this is a good time to learn how to change the paper. Because you won't get a 12 lead until you get the paper in. It should be wrapped up. Simply just tear it, rip it, pull it down. Make sure this is out, make sure this is connected, because if this is not connected, it'll fall out of place. Even false reading. Simply slide it in, make sure this is hanging out a little bit. Try to line this up as square as possible, because if you do print it out, it might fall out wrong. Pull a little bit out, and then hit 12 lead, and you should be ready to go. This is a good time to advise your patient to sit very still. Give them about 30-45 seconds so it can print out and read properly, because if they're constantly moving, you'll get artifact and misreading, and you might have a bad interpretation. Oh, I apologize. Got my cable back up. Try again. Fortunately, this is not one to read at the moment, but it should print out a full 12 lead for you. That way you can look and document it and treat your patient accordingly. Now, if we're back for troubleshooting, like I said, if it doesn't work here, check your cables here to see this connection. If you're still not getting something, check here to make sure this is unplugged. Plug it back in. If not, you might need to get new cables, so contact your supervisor and let your training officer know that you need a new set of cables. Sometimes it's just wear and tear over the years. We troubleshooted the paper here. If you start to print out, it might crumble up if you don't have it properly. If you don't have it properly read out, it should have printed out like this perfectly. If your SPO2 is not reading, check here, because sometimes this gets loose due to people always stuffing it in the back. So you need to at least make sure that's secure so you can have a proper reading. Also, make sure when you hook your cables up, make sure this is also connected. Sometimes this will come loose. It's very rare that it does, but it's just a good indicator to make sure all your equipment's properly used and properly adjusted. Now, some people like to just unclick them here. Some people like to snatch them. I don't recommend doing that because it does hurt the patient. Even though it's a quick grab, simply just unclick all your cables. It's very simple. I like to leave my electrodes on my patients so they can move themselves, because people are very sensitive. Some people have very hairy situations, and we're not trying to hurt them. If you have a hairy patient and you don't have a razor, and you have a cardiac arrest and you have defibrillation pads, simply just take your defibrillation pads. Some will have 2 sets in it, and you can open up a pack, place one of the pads here, and place one of the pads here. If they're very hairy, you can just rip it off and reattach another pad if you don't have a razor. Now, if you don't remember where they go, when you open this up, it will have labels for you so you know which pad goes where, which pad goes here. If you're a medic and you plug this in and you're unsure about how to read the rhythm, when it plugs in, you come here, switch it from lead 2 up to paddles. And that way you'll be able to identify what rhythm they're in if you have cardiac arrest, and if you need to defibrillate or shock, you'll be already in manual mode. I hope that helps you today. If you have any other questions, concerns, please contact one of your supervisors, contact one of your training officers. You can also read the manual. There's different tricks and tips online to help you learn how to get more comfortable with this. Now, with our facility, we do have the privilege of, after treating a patient for as long as we need to, if we didn't have time to put in vital signs in our monitor or into our computer, we have a special indicator here. We could transmit to either to the hospital, especially if we have a very critical patient who's having a STEMI, or we just need our vital signs. We can transmit it depending on what we need to go to. So you hit transmit, and you'll see a few options here. We use ESO, but if we need to go to a hospital, we can choose the proper hospital and transmit it that way. So we can call a doctor, be like, hey, I have my patient, I think he's having a STEMI. This is what I got. Did you get my transmission? And they'll confirm, like, yes, it just popped up on our monitor. Usually it pops up right where they're at immediately, and you can talk to the doctor directly, tell them what you have, what kind of, how the patient's presenting at. Or if you just need, like, well, I didn't have time to put them in, I just need my vital signs. And you can choose if you want everything. Anytime you hit a button on here, whether it's just checking blood pressure or heart rate or just the SpO2, it'll pull up. It'll have everything, or if you just want a simple code summary of just what you've done in the last little bit, or if you just need a 12 lead, if you did a 12 lead, you can print it off and you can always access this later. Thank you, I hope that helps.